if you're fat arming down the main road, you know, like you're thinking how much compression you've got in that left side and how open this right side is, right? And that's going to cause things like these twists and these rotations. And then eventually our spine and the way we move is going to be interfered. G'day guys, Das Ninja here. Today we're treating and talking about internal and our external obliques, muscles that are sort of this portion in this core and our lateral part. So what we think about when we have dysfunctions with our external obliques is we see shifts and tilts, almost like a twist in our core. And what we can get confused with is things like scoliosis. So people that you think have a scoliosis or a curvature in their spine can actually be coming from tightness, a pulling or a tractioning of our external obliques. So our external obliques will pull to the opposite side. So what it does is it rotates the trunk. So this side here, as I turn to my left, this side's pulling to my left. But on the internal obliques, will pull to the same side. So it'll also assist in flexion and rotation of the trunk, okay? But what we're gonna do is I'm gonna show you how to treat it. I'm gonna show you actually on this first too. This book is the best book in the land, Myofascial Dysfunction Trigger Point. Amazing. So we can see here, this is our internal oblique, and we can imagine how if this was short and tight and contracting, how the same side would pull our rib cage closer to our pelvis. And then this is our external oblique, how it would contract, it would rotate to the opposite side. Okay, so not to get confused, there we go. So quite a large muscle mass, covers a lot of area in the core. So we sometimes misdiagnose scoliosis for tightness and twists coming from here. So if you see somebody that has a nipple that's closer to their pelvis, that'd be funny, wouldn't it? Nipple right down like that. Then you've got to get in and target this guy. So what I'm going to start with.
Sorry for interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now, thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content, updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the Academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just 28 bucks per month. How good's that? $7 a week. Let's go!
Is it actually originates in this sort of ASI region, as you could see earlier. So what I like to do is get my fingers, and I get to like start to treat there to really target those external obliques. So working quite not too invasive at the start. Go quite soft and just feeling in, because it is a really sensitive area. Not a lot of people like to be poked or prodded in this area, as you can imagine. All right, really good. So what I'm doing is I'm just feeling, so if I went deeper into here, you'd go deeper into like your hip flexors, into your iliacus. I don't want to go deeper than that. I just want to stay at this sort of lighter level and just working and maneuvering this fascia and this tissue. So just hydrating this, yeah, so that's what you can start with. Just some. What we like to do is we always go to the origin sites, the tendons, where muscles attach onto the bones, right? So we're sticking to our philosophies. We're going close to that ASIS, which is the anterior part of his pelvis, and we're working that. And I can also come in here, Leo, and I can also, like, as I peel that away, is get my thumb in there. You can really see that bony landmark. Really open that up. You can see that I'm working those obliques. Really good. So I guess office workers, drivers, somebody that has one arm up, like if you're fat arming down the main road, you know, like you're thinking how much compression you've got in that left side and how open this right side is, right? And that's going to cause things like these twists and these rotations. And then eventually our spine and the way we move is going to be interfered. So working that, what I like to do is try not to dig too much with my nails and just work like in a nice circular motion out. So I'm hitting now, his last floating rib is here. We know that it covers that area. Like you can see up here, that's rib, but that's where a big portion of our obliques are as well. Yeah, so I'm starting there. Now what I'm gonna do is actually just get my hand in and do like a really nice hydrating stroke. So getting a broader palm into that area to cover more of this area and just open that up. So if that rib cage was quite down and repressed, we would encourage the tissue in the right direction to really open that up. When I was learning about this muscle, I was actually interested in the fact that it can mimic things like heartburn. So if you've got symptoms of heartburn, maybe it's worth trying releasing your obliques, getting a practitioner get in there and releasing this area, seeing how you feel afterwards. Because that's an interesting one. You know, I know so many people who have heartburn. My dad is one of those, constantly getting it, and that's an acid reflux thing, isn't it, Ninj? Usually when you've got that, you're going to get on the apple cider vinegar. That's a good one for it, isn't it? Get the digestive enzymes prepared for food. There's a deficiency in your digestive enzymes. They're not breaking down the food, so it's coming back up, isn't it? Is that sort of...
Yeah, I think there's a few things. Even leaky gut, sort of damage, holes in your gut and the damaged tissues in there. You need to heal that up. Get your microbiome healthy. I think it's a big thing. So like Aaron's asked to say, not Aaron. Break down your food enzymes. So you know, kind of, and like my little plug here for raw food. Like enzymes are in raw food, but when you cook the food, heat the food, the enzymes die. So then you're relying on the enzymes inside your stomach and acids inside your stomach to break down the food rather than it being able to break itself down. I suppose enzymes are bacterias and things like that. So we kind of have this, I suppose out there in the world is a fear of bacterias, but the thing is 10 times more bacteria than there is human cells just in us, you know. So they've got a job and
got a role.
So they've got to break down things. So
I guess when you're going back to like leaky gut and what's causing leaky gut, what's causing these things, it can just be poor health, right? Like poor food, poor nutrition, taking things like anti-inflammatories, overusing Panadol, painkillers, alcohol, all these types of things. Really cooked and processed foods are going to cause a disruption to your stomach health and your gut health.
And they talk a lot about the chemicals and colours and flavours and things like that in foods.
Just preservatives
added in that aren't necessary. And probably if you're eating that sort of stuff that's got just a list of ingredients, that's not real food. You know what I mean? It's just processed, packaged, long life kind of things. It's, if you can get back to the garden, get fresh, seasonal, organic, you're going to be all right. You'll go a long way towards being healthy, vital, healing yourself. But raw food, if you can kind of get a lot more raw food into your body, you're going to have a lot more success with your health.
So what I'm doing here, Leo, is I'm actually working, they cover like the ribs as well. So what I'm doing here is, you could see on that book, is just working in between the ribs, where I'm going to be hitting things like intercostals. But as it's quite a superficial muscle, like it's not deep, we don't need to go super deep for it to be effective. But again, working the fascia system, we're hydrating that irrigation system that we always talk about, that hydrates our tissues and keeps us reactive and proactive, is making sure we get into these areas, and it is going to prevent, again, as we said, the posture abnormalities or the dysfunctions, but also just, if you've got pain or discomfort in your stomach or in your rib cage, it's going to be a muscle that we're going to target and go to. And we probably haven't done a lot of treatments on our obliques, so just showcasing how we would do it here, or how I would do it. So there's a thumb. We can also start to use more of my fingers, not so much the knuckles, right? Like we can use the knuckles in here, but my fingers are going to be something that almost spreads the rib cage apart and just works over the top of it. And poor old Ninja's being the dummy today. It's not comfortable.
It's all good. Therapeutic.
For
the greater good.
That's a good way to put it.
And there's, within anatomy too, Aaron talks about this, about where your heart's on your left side and the lungs down lower, I think, as well. So you can kind of space, can be different on the left. Most people have problems on the left, I think it is, just because of the physical organs in that space. So,
yeah, we're always getting caught up trying to be symmetrical, and we're not symmetrical as humans. There's a heart on the left, there's not one on the right. There's different organs and things all combined in our body that we are trying to always achieve this perfect symmetry where it's just totally unachievable. It's about movement. It's about how well you move and what you can do. Can you lift? Can you sprint? Can you throw? Can you run? Can you squat? Can you, all these types of things. That's what I think is the best way to judge posture and ability. Not so much how straight someone stands or how perfectly aligned their shoulders are. That's great. Can you throw a ball or run? That's the test. That's the test of time.
Yeah. Running and fighting.
Running and fighting. Got to hunt and gather your food or pick it or survive, run away from the predator, whatever it is. Got to be strong and capable. All right, and just a little bit off topic, we're going to also go to these upper abdominals. So you can see rib cage there, a bit of a flare. If we get a little bit of a flare there, or repress, so say that rib cage is really pushing down, we just like to get in there, sort of open it up a bit. It's a bit nasty. Also got our diaphragm, which is a muscle up under this area as well. So sometimes as we breathe in, our diaphragm pushes down, and as we breathe out, it comes back up, right? So it's getting in and out of the way of it does the opposite to that. As we breathe in, our lungs fill up. Our lungs fill up this area, our diaphragm pushes down. But when we get knotted up with this fascia and with these upper abdominals and all these muscles in this area, our diaphragm doesn't sort of move out of the way, and we get like blockages and things in this area as well. So the diaphragm needs to move out of the way as the lungs fill up, and we don't really enter that because of our shallow breathing. So we're breathing really shallow. We're not really getting that true expansion of that rib cage. We feel quite shallow through here and blocked. And take some deep breaths. Release this area. See how you feel. So I'm tracing that all the way down. See the redness in the tissue too. We're getting more blood flow into that area. We're entering sort of like the pyramidalis down here, the little triangle muscle right above the pubic bone. Nice one. One more. Just a little bit lower. Fantastic. Well, that's a treatment on our internal and external obliques. If you have some twists in your core, if you're struggling with rotation, train rotation firstly, but also getting there, unravel the tension and the build-up, and hydrate the body and see how you feel. If you liked our videos, make sure you do like the video, subscribe, and head to our Patreon for extra content. But thanks for watching, guys.
Done.